I think CONA is different because it's an independent practice. We're not owned by any hospital or corporation, so that gives us the autonomy to make our own decisions about how our practice runs, what's the best thing for our patients, where we want to practice, and just be able to make things run the way we want them to. I think it's such an advantage that it's a multidisciplinary practice. We have neurosurgeons like me, we have orthopedists in different orthopedic specialties, we have pain specialists who help take care of patients with chronic pain. You know, if a patient shows up in my office and they have multiple problems, then oftentimes we can help with all those problems, not just one. So in a sense, it's like one-stop shopping.